Dear students, welcome back. In the previous session, we have seen the introduction of elbow joint, elbow complex. In that elbow complex, it includes elbow joint, which includes humero-ulnar and humero-radial articulations, as well as the proximal and distal radio-ulnar joint. Now, in this session, we are going to see the structure of elbow joint. In that structure, we are going to see the articulations, articulating surfaces of the elbow joint, and also articulating surfaces of radius and ulna, and articulations of all these joints. Okay, now the first thing is, before going to understand the articulating surfaces, so just we are going to revise the anatomical parts of those bones which are forming this humero-ulnar and humero-radial joints. So in this, proximally in the elbow joint, it is formed by the trochlea and the capitulum, trochlea and the capitulum of the lower end of the humerus. Yes, so now we'll see some of the parts of the lower end of the humerus. So it consists of, so here the lower end is expanded and which is triangular in shape, and it is having on the medial side non-articular areas called medial epicondyle. On the lateral side, it is having lateral epicondyle, and it is also having some ridges on the lateral side. The medial epicondyle is proximally expanded as supracondylar ridges, and also the same way on the lateral side of the lateral epicondyle also. And now coming to the articular surfaces, these are the articular ends. One is the capitulum and the trochlea. So here the trochlea is a pulley shaped or hourglass shape, and capitulum is a rounded, so which are placed on the anterior aspect of the lower end of the humerus. Above this trochlea, some indentations are present. So above the trochlea, you will have a fossa called as coronoid fossa, and above the capitulum, you will have the radial fossa. So these are the things we have seen on the anterior aspect of the lower end of the humerus. Coming to the posterior aspect of the lower end of the humerus, it consists of medial epicondyle and lateral epicondyle. Here some part of trochlea we can see on the posterior aspect, and a deep indentation when compared to the anterior indentations will have a deep indentation present on the posterior aspect called as olecranian fossa. Okay, these are the proximal articulating surfaces or articulating structures which are seen on the lower end of the humerus. These are the anatomical parts. Now we will see in detail about these articulating surfaces. So the articulating surfaces on the anterior aspect. So what are the things which we have seen on the anterior aspect? We are having two non-articulating surfaces and two articulating surfaces. So the articulating surfaces on the anterior aspect of the distal humerus are, one is the pulley shaped or hourglass shaped trochlea, and another one is the spherical capitulum. Spherical capitulum. And these structures are situated in between. So where these structures are located? These structures are situated between the medial epicondyle and the lateral epicondyles. Here the trochlea which forms the trochlea which forms the humero-ulnar articulation. The trochlea takes part in humero-ulnar articulation, and which sets an angle on the medial aspect of the distal humerus and lies slightly anterior to the humeral shaft. So this forms an angle on the medial aspect, this trochlea, and also it is present slightly anterior to the humeral shaft. Okay, and a groove is present. Here you can see this is the groove. Groove is present in between the trochlea. That groove is called as trochlear groove, which spirals obliquely around the trochlea and divides this trochlea into medial part and the lateral part. Okay, and the medial portion of the trochlea projects distally downwards. If you can see, so here, so this trochlea is extending downwards medially more than the lateral part and results in an angulation called as valgus angulation of the forearm, called as carrying angle. So this trochlea, or I have already mentioned that this take part in the angulation on the medial side. That angulation is called as valgus angulation of the forearm, which is called as carrying angle. Okay, and this is about the trochlea, which forms the humero-ulnar articulations of the elbow joint. And above this trochlea, you'll have an indentation called as coronoid fossa, and this fossa is designed to receive the coronoid process of the ulna at the end of the elbow flexion. Next, coming to the capitulum which forms the humero-radial articulation and which is also located on the anterior lateral surface of the distal humerus. The capitulum, like the trochlea, lies anterior to the shaft of the humerus, and a groove is present in between the trochlea and the capitulum. This groove is called as capitulotrochlear groove. This groove is called capitulotrochlear groove, which separates this capitulum from the trochlea. The indentation is located on the humerus. So an indentation is located on the humerus just above the capitulum is called as radial fossa, and this fossa is designed to receive the head of the radius in elbow flexion. Okay, and this is about the radial fossa and the capitulum. So these are the two articulating surfaces which are found on the anterior aspect of the distal end of the shaft of the humerus, which are forming in radio-ulnar joint. Okay, now posteriorly we have seen a deep indentation that is called as olecranian fossa, which is present on the distal part of the shaft of the humerus on the posterior aspect. This fossa is designed to receive what? Olecranian process of the ulna at the end of the elbow extension. Here you can see this is the olecranian process during extension. So this one is exactly fitting into the olecranian fossa, and this is the locked position of the elbow joint in extension. Okay, so this is happening when elbow is extended. Okay, so these are all the articulating surfaces which are present on the shaft of the humerus distally on the anterior aspect as well as the posterior aspect. So what are the articulating surfaces? Proximally in the elbow joint, especially in the humero-ulnar joint, the articulating surface is the trochlea. Whereas in the humero-radial joint, the articulating surface is the capitulum. The capitulum is present on the lateral aspect, whereas the trochlea is present on the medial aspect. And this trochlea forms an angulation called as valgus angulation on the medial aspect of the forearm called as carrying angle because of its extension of the trochlea distally on the medial aspect when compared to the lateral aspect of the trochlea. Okay, and some of the forces which are present on the anterior aspect are the coronoid fossa and the radial fossa. These two fossas are designed in such a way that these two fossas fit with the coronoid process of the ulna and the head of the radius, circumference of the radius into the radial fossa during flexion, during full range of flexion respectively. Whereas on the posterior aspect, it is having a deep indentation called as olecranian fossa. This fossa is designed in such a way that this fossa is fit by the olecranian process during full range of extension. This is about the articulating surfaces of the humerus. Now we are going to see the articulating surfaces of the ulna and the radius. So now coming to this is the ulna. We can see the lateral view and the anterior view. The articulating surfaces of the ulna is forming the humero-ulnar joint, which is deep. Here the articulating surface is deep and which is semicircular concave surface called as trochlear notch. This one is called as trochlear notch. You can see here this is the trochlear notch. This is also trochlear notch. So the articulating surfaces of the humero-ulnar joint is deep semicircular concave surface called as the trochlear notch. So the proximal portion of the notch, this one is the proximal portion of the notch, is divided. So this is the proximal portion of the notch. So it is divided into proximal part and this one is the distal part. This proximal part consists of a ridge. This one is the ridge. So it consists of a ridge which divided into two unequal parts. The proximal part of the trochlear notch is divided into two unequal parts by a trochlear ridge. So because this ridge and these two articulating surfaces, unequal articulating surfaces, will articulate with the trochlea of the humerus. Okay. And this ridge corresponds to trochlear groove on the humerus. The trochlear groove is present on the trochlea, which is dividing into medial and lateral part. So that will articulate with this trochlear ridge. And now coming to this ulnar coronoid process, this one is the distal part of the trochlear notch. So this ulnar coronoid process forms the distal end of the notch, while the olecranian process projects over the proximal end of the notch. So this is about the articulations of the ulna here. So this coronoid process, so which is going to be fit into the coronoid fossa, which is present above the trochlea. So this is about the articulating surfaces of the ulna. Now we will see the articulating surfaces of the radius. So here comes the radius. So radius is having a head. So here you can see the radial head, and over this at the center of the rad you will have a depression called as fovea. So this fovea will articulate with the spherical part of the, that is capitulum of the humerus. Okay. Now the radial articulating surface of the humero-radial joint is composed of the proximal end of the radius known as head of the radius. The radial head is slightly cup shaped. Because of that depression it appears as slightly cup shaped, and which is concave surface called as fovea. That concave surface is called as fovea here, and that one is surrounded by a rim. So that one is surrounded by a rim, that is the circumference of the radial head, which appears as a rim. This radial head convex rim, so that the rim which is present, which is surrounding around this fovea, will fits into the capitular-trochlear groove. So whereas this convex surface, that is fovea, articulates with the capitulum, whereas the rim is going to fit into the capitular-trochlear groove during the articulation of the humero-radial joint. So these are all the articulations of the elbow joint. Proximal articulations are by the capitulum and the trochlea, which are present on the distal end of the humerus, and distal articulations are the proximal ends of the ulna and the radius. In the proximal end of the ulna, it is having two processes and the proximal end. One is the olecranian process and the coronoid process. In the proximal process, it is divided into two unequal parts by trochlear ridge, and this one articulates, these two things will articulate with the trochlea anteriorly as well as the posteriorly, forming humero-ulnar joint, whereas this radius, head of the radius, will articulate with the capitulum of the humerus, forming humero-radial joint. Okay, now in the next thing we are going to see the articulations of the humero-ulnar joint as well as the humero-radial joint. So whatever the things we are seeing individually, all will come under elbow joint, and this elbow joint is a component of elbow complex. Okay, we are seeing individual joint articulations, but you have to understand these articulations combinedly, because the movements are taking place simultaneously. Both humero-ulnar joint and humero-radial joint combined action causes elbow flexion and then elbow extension. But now we are seeing each individual joint articulations. Finally, we have to combine these two articulations to understand the function of the elbow joint, which is a part of elbow complex. Yes. Now we will see the articulation of humero-ulnar joint. In the humero-ulnar joint, so the articulations between the ulna and the trochlea forming the humero-ulnar joint. Okay, how the articulation takes place here? The articulation between the ulna and the humerus occurs primarily as a sliding motion, which is very, very important. It will slides. The ulna will slides over the humerus. Okay, our humerus will slides on the ulna. So it may depends upon the closed packed position or open packed position. Okay. Finally, what is the motion taking place inside the joint? That is the sliding motion. So articulation between the ulna and humerus at the humero-ulnar joint occurs primarily as sliding motion of the ulnar trochlear ridge. So a ridge is present, so that one will slide. Ulnar trochlear ridge on the humeral trochlear groove. So on the humeral trochlear groove, which enters in extension into the olecranian fossa, that is the olecranian process. During extension, this ulna will slide on the trochlear groove of the humerus, and this olecranian process will fit into the olecranian fossa during extension. In the case of flexion, so these two are the flexion. In the case of flexion, the trochlear ridge of the ulna slides along the trochlear groove. Same. So, but it will slides now, it is anteriorly. So, the ulna slides along the trochlear groove until the coronoid process reaches the floor of the coronoid fossa in full extension. So that is the end part of the sliding motion of the humero-ulnar joint. Okay. So during flexion, what will happen? The coronoid process will fit into the coronoid fossa. During extension, the olecranian process will fit into the olecranian fossa. What is happening during extension and flexion? There is a sliding motion occurs in between the trochlear ridge of the ulna with that of the trochlear groove of the humerus, causing extension and flexion. During extension, this process, olecranian process, will fit into the olecranian fossa, that is the end of the extension. During flexion, the coronoid process will fit into the coronoid fossa, that is the end of the flexion. That means the sliding motion or between these two surfaces will going to be stopped. Okay. Next. Although the opposing articulating surfaces of the trochlea and the trochlear notch appear to be completely congruent. So this ridge and the groove are completely congruent. Okay. And some of the investigators have done some experiments with cadaveric specimens have shown that the articulating surface of the trochlea does not contact the articulating surface at the bottom center of the notch unless if it is loaded, unless the joint is heavily loaded. So that means here the surfaces are not contact in between the two surfaces of the joint in normal movement. Only during loading only these two joints are going to two articulating surfaces are coming to contact. And also they have explained that if a person is having lifting a load of 25 newtons with elbow position at 30 degrees and which increases up to 120 degrees of flexion, there is no surface contact occurred between the trochlea and the depths of the trochlear notch. But at the load of 500 newtons, the articulating surface contact areas expanded from the sides towards the depth of the notch. That means only at loaded thing only the surfaces are going to be contact. In the remaining cases, the surfaces are not in contact. Here, if you can see in these pictures, so it is not loaded here, but so if this is the wall and there is no resistance applied here, so here the contact surfaces is not seen here, contact of the surfaces, but here at the sides we can see the contact of these two structures. Okay, so this is about the articulations of the humero ulnar joint. Okay, so though the ridge is articulating with the trochlear groove of the humerus, but the contact in between these articulating surfaces are not seen during unloaded conditions, but during loaded conditions the contact from the sides towards the center is seen when a load is applied. Okay, so that means area of contact is increased. So in the textbook and in the literature they have told that the contact areas are expanded, means the area of contact is increased in between the articulating surfaces when the load is applied. If the load is not applied, there is no contact between the articulating surfaces. This is one of the important biomechanical aspect of this elbow joint. Okay, now coming to the articulations of the humero-radial joint. So in the case of humero-radial joint, so this is the capitulum and this one is the head of the radius, and above this you'll have this radial fossa. Okay, this is the elbow flexion and this one is the extension of the humero-radial joint. Articulation between the radial head and the capitulum at the humero-radial joint also involves sliding motion. That means it also involves the sliding motion of the shallow concave radial head over the convex surface of the capitulum, over the convex surface of the capitulum. the humeral capitulum here, the humeral capitulum is smaller than, slightly smaller, not as much as bigger, so slightly smaller than the corresponding radial fovea, that is the concave surface or the depression over the head of the radius. So the joint surfaces are slightly incongruent because of slight variation in the size of these two articulating surfaces causes this articulating joint surfaces are incongruent. In full extension, there is no contact occurs between the articulating surface. If you can see here, there is no contact between the capitulum and the head of the radius in extension. Okay, in flexion, what will happen? The rim of the radial head slides in the capitulo-trochlear groove. So the groove which is dividing the capitulum and the trochlea, the rim is going to slide in the capitulo-trochlear groove and it enters the radial fossa as the end of the flexion range is reached. So this is the thing happened during humero-radial joint articulation. The articulation is taking place between the capitulum which is present at the distal end on the lateral side of the humerus on the anterior aspect, which is going to articulate with the fovea of the head of the radius, and also the rim of the radius articulates with the capitulo-trochlear groove, and it finally enters into the radial fossa when it reaches full range of flexion. During extension, there is no contact between full extension, there is no contact between the capitulum and the radius is seen. And these are all about the structure of the elbow joint, which includes humero-ulnar and humero-radial joint. And this we have seen the articulating surfaces of the humerus and also the articulating surfaces of the ulna and radius and the articulations of all these bones which forming the elbow joint. In the next session we are going to see the joint capsule and the ligaments around this elbow joint.